So hernias are weaknesses in a containing structure. And if these weaknesses are allowed to progress over time, the contents can pass through that containing structure into an abnormal position. And in my line of work, in the abdominal cavity, the weakness will be through a natural area in the body where one structure passes through to another body cavity, for instance, the stomach or gullet into the chest. You can get a hiatus hernia there, or perhaps if the blood vessels pass from the abdomen into the leg, you can get a femoral hernia around that weakness as well. So what happens is that the patient will then usually get some discomfort or pain, or notice a lump that comes outside the abdominal cavity, and they will seek some attention from their physician. So when we assess a patient for a hernia, obviously we take a full clinical history and examine the patient. We may need some imaging to assess whether a hernia is actually there or not. And then its anatomical location, its size, etc., because these are important aspects of a hernia to plan effective surgery for the patient and give them the best outcome. So most hernias are relatively small. They're relatively simple to assess and repair. Some of the more complicated scenarios that we might come across involve incisional hernias, particularly where a surgeon has already been through a bigger incision in the abdomen. And this is usually after complicated emergency surgery, where the priorities for the patient were keeping them alive. And the patient's had a prolonged recovery, meaning that their wound really hasn't healed properly and has developed a weakness. So these are bigger hernias, require more complicated assessment, and quite usually they require a little bit of tissue manipulation before we put the mesh in, because just bridging a large gap with a mesh is prone to recurrence. In addition to this, patients may actually have a stoma as well, so a loop of bowel coming up to the surface, which is a natural hernia itself. And so trying to repair a large incisional hernia and repair a peristomal hernia at the same time can be extremely complicated. And this really requires now a multidisciplinary approach with lots of healthcare professionals involved to get the best outcomes for the patient. So the prognosis for hernia repairs in general is very good. The vast majority of hernia repairs that we do would be groin hernia repairs. About 3/4 of our hernia workload would be groin hernias. And these are repaired by keyhole surgery as a day case. And it's not an operation we get a huge amount of trouble with, to be honest with you. Occasionally someone can get into trouble with chronic pain, go into urinary retention, or get a recurrence. The official recurrence rate is about 1 to 2%, so not common at all. For the more complicated hernias, obviously people would need to stay in hospital for longer. Some of the very complicated incisional hernias can require up to a week in hospital with drains and careful assessment afterwards. The prognosis really depends on the size of the hernia, the anatomical location, and the particular considerations and comorbidities applied to the individual patient. It's really important with hernia repairs that we sit down with a patient in clinic and just clarify what their expectations are from the repair. In order to plan a really good hernia repair for a patient, it's not about the type of mesh you use or the approach you use necessarily. It's about achieving the objectives of the patient. And so all of this is very important to talk about in the clinic beforehand and get the consent process right. Each hernia has its own individual characteristics and complications according to the patient that you're dealing with at the time. So even very simple hernia repairs can turn quite complicated if you don't get that preparation right. And then on the day of surgery, it's about just going back through those things that you've talked through before getting the final consent, and making sure you've got exactly the right staff with you and the kit with you to make sure they have a successful repair. So hernia repairs are generally very successful for patients, and they have a high rate of correcting the symptoms that the patient has presented with. So for the majority of patients, we would look to close the weakness or the anatomical defect and support that closure in the healing period afterwards with a mesh. And most of these meshes are synthetic meshes, and your own body's scar tissue will grow into the mesh. And these have a very low complication rate. So generally speaking, patients after a day case keyhole hernia repair will have a very good outcome, and all of their symptoms will have resolved nicely.